What's up, guys? It's me coming to you all looking like somebody's mother. I know it's only Tuesday, but this week has been something else. And I'm tired. Alright, this is a health update because with all that's going on, it's a pretty good chance that you guys are not up to date. So, I took some little notes. I just left the hospital. Turn the car off. So yeah, got all the info from the people that know stuff. I broke it up into like 3 categories so that it could like be easier, I guess. So the 3 categories are the heart, the lungs, and the kidneys. Don't pay attention to my crusty nails. They're going through it right now. But anyway, so heart, lung, and kidneys is what we're focused on right now. And I will say, out of the 3, none of them are actually quite doing what they're supposed to be doing, like 100%, according to doctors. So as far as the heart is concerned, her heart function is not 100%, even though it's a new heart. It's not as bad as it was, but it's not as good as it could be. So her heart function it was out of 49, I think yesterday or the day before that. 49 EF. I can't remember what the EF stands for, but the number is what's important. It's now a 60, which is good. It's still a failing grade, but it's still functioning enough to get by. Her PVCs. Okay, so this is kind of what I need to talk to you guys about because some stuff had happened. PVCs are basically like abnormal heartbeats, arrhythmias, things like that. And we all know that Lexi's had issues with that with the old heart. This new heart has decided to be weird as far as the heartbeat are concerned. Saturday, because today is Tuesday. Saturday, her blood pressure dropped significantly and her pulse completely dropped, meaning she flatlined. And that was due to an excess of lung fluid and a couple of other things. They weren't 100% sure what caused the PVCs, but they think it had a lot to do with the lung fluid and stuff like that. So it was basically like a situation that she had had months before where she went into cardiac arrest and they had to bring her back. This time they did the same thing. They did chest compressions for 2 minutes. And I feel weird about it because through every like traumatic situation or episode that Lexi's ever had, I've always been there for it and for her. And this particular one I wasn't there for, and I kind of am like beating myself up about it because I feel really bad. It's so crazy because I had just left. Not even 20 minutes, not even between 15 and 20 minutes, I get a phone call saying that what happened with her pressures and they had to do chest compressions to bring her back and everything. So of course I came lickety split right back. It was a bit it was a bit much. It was a bit overwhelming to know that she had gone through that and I wasn't there. And I kind of like expressed that to a doctor, like, because I had shed a couple of tears and I was like, my tears really aren't from the fear of not knowing that, whether she's going to be okay or not. My tears are really coming from the guilt of not being there when it happened. Because I'll be having to clarify my tears. They're not just for fun. And since that's happened, she has had a couple of PVCs here and there, but they've been decreasing slowly but surely. Last week she had a biopsy, and the results for that came back. Everything is negative as far as rejection. Rejection level is at a grade of 0, which is no detected cellular rejection. She's tested negative for antibody rejections that her body makes up and that the donor heart creates. There's no antibodies being formed to attack her heart. So that's basically everything that's going on with the heart. Alright guys, so like literally in the middle of me recording this, I just got an update from one of the doctors saying some things that I'm about to let you guys know. Lungs. So Saturday during the day, I was there and she was coughing, and I noticed like the secretions that she was coughing up were like, had like a pink tinge to it. So my concern was like bloody lungs. So I mentioned it to them. They said they'd be keeping their eye out for it and just watching it closely. So it turns out that it has turned into like pulmonary hemorrhaging, I think that's what it's called. So her lungs are doing a little bit of bleeding. There's no real way to quantify how much blood is actually in a lung, because lungs are like sponge. Adding to the fluid that they're trying to take off of her, and they're using a dialysis machine. I believe I talked to you guys about that in the last update, but things got tweaked a little bit. I'll talk more about that part when I talk about kidneys and stuff. She's also got something called pneumothorax, which is air around the lungs. Yep. And they've tried things like increasing her vent settings, because she still has the breathing tube in. They tried different ventilators, so like different types of like breathing machines. They tried suctioning, of course, which is what they were doing on a regular. They've tried, what is it called? Basically the manual form of what's it called, a bag mask or something, bag mask ventilation or something like that, just to help expand her lungs a little more. They increased her nitric oxide, but none of those things were really doing it for her lungs, because the issue is that her sats were dropping to like the mid to low 80s, and that's, cause for alarm. Anything under 90, they're looking like, okay, let's watch it. When it starts to creep under the 90s, that's when they start to do things, and hers was getting as low as like the mid to low 80s. I was talking to them and they felt as though the best bet for Alexis would be to put her back on ECMO. And we had a discussion earlier in the week, like in the weekend, about putting her on, because of the last episode of cardio arrest that she had. They were thinking about putting her on ECMO for her heart and lungs, just to give those two organs a break. But she started to recover a little bit better. After she had gone through the episode and they brought her back, they saw her numbers increasing, and they realized that they didn't need to be so invasive and put her back on ECMO. The doctor just called when I was recording and let me know that they still haven't put her on ECMO yet, because that was going to be their solution. VV ECMO, and that has to do with solely the lungs, not the heart. But this is ECMO to support the lungs. Her oxygen levels are trying to creep back up a little bit with the interventions that they've tried, because at first it wasn't working, which is why they figure ECMO will be the best thing. Since they gave it some time, her numbers are starting to increase a little bit and look a little better. But they're still trying to figure out if they want to just go ahead and put her on ECMO to give her lungs a chance to heal by themselves and let the dialysis help with pulling the fluid off. Speaking of dialysis, so the last topic of discussion is Lexi's kidney. She's been dealing with like an acute kidney injury since the heart transplant. We've been having some slight kidney issues, but you have to put into consideration all the different types of meds that she's on. that are new to her system now. So her kidneys are have taken a hit. There was talk of long-term dialysis. How long? Nobody really knows. But that was just an idea that some of the doctors were just throwing out there just so it wouldn't be such a shock if they had to take that step. The PD catheter is what she is going to be put on Monday. Doctors just told me that when I was on the phone. So Monday they're going to, I don't know why they're going to wait so long. Like, wait a second. I need to ask them about that. I was just on the phone and that was one of the updates. Monday. But today is Tuesday. That's like a whole week from now. Why are they going to wait so long? I found out. This week has just been, I've been fighting myself like on the inside because I've been like frustrated with a couple of things as far as this whole journey. I guess part of me not being prepared for what life after the heart transplant would look like. Me still not knowing what life after the hospital is gonna look like. I feel like lately, like this past week, it's been kind of something that the doctors have had to tell me almost every day, and I just haven't been letting you guys know. But things have like kind of come to a head, and they're really cracking down just to try to get her recovery going in the right direction. Because we've had hiccup after hiccup. I'm tired of hiccups. It's time to drink a glass of water and keep it moving. I'm gonna do something productive. Throw away some things. That always makes me feel better. But alright, until then, I will be seeing you guys later.